Anybody else? No, no other lymph massage. So this is going to be fun.
Debbie has, Sharon has.
Oh, I was
Debbie
expecting
has.
voices. Sorry, you're right. No, and I know Debbie has too. Okay. So we have had some people. That's great. We're still going to, I'll just go over what it is. It's light touch massage. It's more of a skin stretching that is going from your extremities, moving all that lymphatic fluid that we have that clears toxins out. It moves it back up and out. So when you get that toxin relief, when your system starts working on its own to pull toxins out after you get that massage a few days in a row, you see the lymphatic system actually continue to speed up those next 48 to 72 hours. And what that means is that then your body's more capable of healing itself when you have all that clearing. Sometimes you'll feel lighter weight. Sometimes you'll see the weight come off. Sometimes you'll see decreased inflammation overall body. A lot of joint inflammation will go down. This is a massage you do to help your sleep, to help reset your parasympathetic nervous system. It's something that is deeply relaxing on the table. A lot of people fall asleep, like I'd say 80–90% of my people will fall asleep on the table. But like I said, skin stretching. So, I mean, part of this is I want to be a demo because a lot of the at-home stuff is so important for me to share with people because this is accessible. We can do it ourselves. We can have our partners do it for us. You can look up videos online. It's starting to be really mainstream to get some stuff out there, which is exciting in the last couple years because up till this point, it has not been. One of the more exciting things this year too, which is kind of silly / I don't know, whatever. But my mom called and was like, Kelly, I saw mainstream media on traumatic brain injuries and lymphatic massage practices opening. And that's huge for my mother to be like, ooh, I just saw this pass from a friend. So keep an eye out, share any articles you're seeing mainstream, but do know that lymphatic massage is kind of trickling into mainstream via traumatic brain injuries with the NFL football players who have experienced real major psychiatric effects afterwards and are having really hard time controlling anger and outbursts and repetitive concussion problems. So they've identified lymphatic work and the neural lymphatic system in the last since 2015 and really started to focus on it. And you're going to see our 5-star medical programs start rolling out those immunology programs and lymphatic education programs. So the doctors you're going to see coming out of those particular programs are going to have lymphatic curriculums now. So the dynamic and the conversation is going to get to change soon. So that's just a big celebration this year, particularly. People are talking about it more. And I hope you all share the word lymphatic massage and really talk about the fact that this can really help you clear out your immune system. And when your immune system's clear, your inflammation goes down, your ability to flush out old debris goes up. You're going to start getting that tissue healing. You're going to start getting rejuvenation happening and more efficiently, and your body overall working more efficiently. With that said, clot, if you're a clot person, you're not going to want to do this full body massage stuff. Little bits of boost, if you can tolerate touch, is fine. But if you have clots, you don't want to do a lymphatic massage and move that clot. This moves a lot of fluid. So clotting, heart conditions, you're not going to want to do lymphatic massage until you're really squared away with a doctor. We would work closely with any physician always. And if you don't find a manual lymphatic drainage therapist out in the community affordable, which is a big problem, I know. And my goal is to make this affordable for people who are already in chronic despair, really. And it can't be $150 an hour for those people. They can't afford that. And when you need a daily flush for chronic, we're talking 7 to 15 days. 4 days is going to give you a good boost, but you're really going to start seeing that transition and like long-term advantage when you do 7 to 15 days. Other countries do 30 days, primarily German modality that I practice. See an American for 30 days in a row for a full detox program, right? So we think about the FDA and all these chemicals we have in our particular country, in our food, and if we're not conscientious of those things, our lymphatic system does take a toll on that, and it's working harder for us. So our goal is to let your immune system do its job more effectively through the skin stretching. And if you know anything about myofascial techniques in massage too, it's that idea that you're stretching skin away from each other. And a good example to do this, just to relax you while you're there, is get nice and tall, take a good, nice deep breath. Get that nice tip of your head with a little pull upwards while your tailbone's kind of pushing into your seats. You're getting that whole nice length through every vertebrae, through every part of your spine. And then just take your fingers and join them at the base of your skull, in the back, behind your neck, and you're pulling it apart very lightly. No pressure really, but just start pulling that skin apart, and you hang on to it for a really long time. That is a myofascial technique where your skin stretching, where I'm taking that skin and I'm pulling it apart, right? And you can just hang on. You don't have to move it. Liz, I see you moving. You can just hang on to it. And after a while you're sitting there and breathing and working more on your spine and your length and your tallness and pushing into the seat and pushing up into the tip top of your head and still stretching, you'll notice that skin start to slowly spread apart. And when it does, that's when you creep those fingers back in and then continue to start spreading that, okay? So that's a technique to just loosen up areas that feel tight. And so when I do lymphatic work, I do the pattern that I'm going to show you for lymphatic massage. And then this myofascial technique is something that can kind of supplement that, where you start to still feel tight areas of your body. So if you'll just take your arm, and we'll start right before the wrist and just do a couple little kind of circular pumps and actually go in towards your body and up, in towards your body and up, in towards your body and up, and then move above it, in towards your body and up. And you're using just kind of the palm of your hand at this point, in towards your body and up, and then move about half of that. And I'm teaching you the way a lymphatic machine pump works, because the science is there to prove that if you look it up. If you look at those lymphatic massage pumps, they work with little inflatable tubes that overlap each other. So your hand is going to also try to overlap where it went. So if you do a couple skin stretches here, then you go halfway up, skin stretch here, no pressure, just a little pull, and you just continue up the arm, moving halfway up where you were. So you're covering the space twice. And you're making particular importance before and after the joints, because at an angle is just typically where fluid's going to get stuck. Your body's a river. So any place before and after the joints, you can give a couple little extra pumps in here. You know, you're going 5 to 7, basically 5 to 7 pumps before and after a joint, skin stretching in and up, in and up, in and up. And if you will, take a minute to just notice about your own skin, and you can just go back and kind of play with this, because now you get the theory of this, and you do that type of massage all the way over your body, rhythmically, systematically. And at the nature of the full body need is that you want the full body pump working. A lot of times in modern medicine now, they only still work on one body part. Even if you're a breast cancer survivor and they've removed these nodes, you go in for lymphatic work, they're doing upper right quadrant, and they're not going to pay attention to the rest of that body. But what you find is if you pay attention to the full body, just like a river, you're going to find those alternate pathways. You're going to recreate a flow. You're going to find out ways to drain those areas, and just like, 21 days make something more routine. You do this massage routinely, you retrain neuromuscularly what's happening, you reopen those pathways. They're used to being opening and flowing, and then it wants to work itself. It wants to find those new pathways around stuck tissue, scars, old injuries. So, and at the same time, once you get the whole river flowing around it, clearing toxins, clearing old debris, it starts working at the edges of that old scar tissue and stuff too. And you work those scars from outside in. So it's kind of a full body, get the full body flow going. Then those areas that are stuck can start healing. Then you see the ability to, move a little better range of motion, open back up, get some of that fluidity, some of that hardened lymphatic fluid actually does harden, gets crusty, just like you see other body fluids. It hardens inside your body, but with work, just like Play-Doh, it softens again and turns into fluid again, and you can get it going. So old stuck injuries, old stuck scar tissue, this is what lymphatic work does, at the same time boosting your immune system. So I'll also teach you real quick here. How much time do I have? I don't even have a clock. But Liz, how much time do I have?
Yeah, you're good.
Okay.
You've got like another 15 minutes.
Perfect. Okay. And I will say another little silly thing here too, because it was that I called out Liz on calling this massage magical. I was like, now. The
It's science,
conversation around immune health in this country and lymphatic massage is a science,
right?
but it does feel like magic. I have been in 15 years of chronic, I could say all the expletives right now, pain, all of it, dysfunction of all the systems, all the body systems with what I've gone through, to then get 15 days of lymphatic massage and have it all whoosh, kind of go away. I have to be conscious of my immune system. I have to be conscious of my inflammation levels and manage it. It's not that I'm healed, but I am on that pathway. And the beauty of it is you go to this lymphatic massage for these 15 days, and then you might not need it for another year if you do the full clear out, if you do the full thing. And then maybe you feel like you're getting a little bombarded again. Maybe you made poor food choices, or, just not treating your body well, or maybe you've had an injury that got you stuck. You come back and you do that again in a year, maybe, or 2 years. And then after that, you probably aren't going to want it for 3 to 5. And then after that, you're probably not going to need it for 15. Like, this is a thing that is built to flush you out and make your system work, not come to me to make your system work, if that makes sense. So the at-home tools are priceless. You can do this stuff at home, and I'll give you the minimum. Like on my worst chronic days, the minimum of what I'm doing is I'm waking up, I'm yawning, and I'm starting this rebound motion that we talk about, where you're just getting the joints open, bring it into a dance, bring it into a stretch, whatever, using gravity because it's fluid. So we're just yawning, we're stretching. I do the same thing with those feet. I get them up on the wall. I get a nice ankle pump, and you're just pulling those toes back. Just like if you were doing a basketball, that rebound motion up, that's kind of that feel that you want with your toes and your hands. So just waking up your joints is going to do a lot. Same thing with your shoulders. Wake up your joints, wake up your big joints, because that's where fluid gets stuck the most. And think about where we sit and your own patterning throughout the day. How do you sit? Where are your tight spots? Those are places where fluid's going to get trapped, right? And so one of those tests, like we were going to do in my arm, and I got sidetracked, but while you were doing this, there are places that are going to stretch a little further than others. So like here on my arm, we've got this. Here on my other arm, it's a little looser on this side. I actually get another couple millimeters on this side. And that's significant. When you start noticing these patterns, you're going to find out where it's stretchy, and you'll notice 5 to 7 passes of this little circle is going to loosen that area up, much like myofascial. Hang on to it, don't move, do the skin stretching, then it opens up naturally. And you want it to open up naturally, and you don't want a lot of pressure on anything. Otherwise, you're closing layers, where what we want is the stimulation through every single layer. So light as possible, light as a feather, but able to stretch the skin. And you just test where you're tight, test where you're not. It's just indicators to know your body. And a lot of this is body awareness. So I do my pumps in the morning, I yawn. Twists are important, mainly because this lymphatic system is a one-way vessel network. It doesn't have a pump like your heart. It's got to be moved. This is why we're rebounding. This is why we're jumping. But this is why we're twisting too, because the deep lymphatic system needs to operate with the superficial lymphatic system and operate like that river. So you have these other ducts that work to pull from deep to superficial and pull that stuff up. And the thoracic duct kind of pulls at a cisterna chyli right here. It's more of a collecting area. And if you focus on diaphragmatic breath, at the same time you're twisting, you're giving that the manual physical stimulation that it needs to clear out and up that thoracic duct and that cisterna chyli. And you have most of your lymph nodes in your abdomen. Like out of your 750 lymph nodes, 650 lymph nodes, everybody's a little different. Like 450 are in your abdomen. So if you're always breathing up here and not diaphragmatically breathing, you're missing out on clearing all the toxins that you can clear out efficiently. So if you think about just doing one thing, diaphragmatic breath, and a reason to, it's clearing out that abdominal lymphatic system, those nodes, helping all that stuff push through. You can also give yourself a little just nurturing here, People with GERD, all that probably do this naturally, but the reason they do is because physically this is where that fluid gets stuck. So just nurturing, and again, it's the skin stretching, lightweight stuff. Okay, so we wake up in the morning, we do our pumps, we do our legs, we do our feet, and then I typically will do this little kind of twist stretch to get this stuff going, but focusing on the breath. And then you focus on opening the main duct areas. And again, one-way network of vessels moving up. So wherever anywhere gets stuck is where you need to focus on first, so that the fluid has somewhere to go. That's an important concept to understand. So you clear out the main ones, which are going to be at your neck, your armpit, and then at your groin. Actually, this inguinal node, you're right here, right up into the area. And I'll show you just a little demo of everything, and we'll do together. Feel free to join me. This work is just a demo. You're staying lightweight as possible. You're not doing anything major. And we're just going to stick to, like, we'll do 3 to 5 passes to kind of say, if you have any health concerns, don't do this full thing. Talk to your doctor. We'll just do a little disclaimer. But with that said, if you tolerate touch, and typically the same types of touch on your body, you're going to be okay. You may feel some stuff drain through this. So if you got some nice congestion going, you may feel it loosen. But so all you do, and there are different ways to do this, and they're going to be way better instructional videos. I'm doing this quick because of time and all, but you can find detailed stuff in here. You can call me and I can coach you through stuff if you're finding it productive. But essentially, you're cupping every bit of skin you can possibly get along the underside of your jawline up to your ear, down here, just above your clavicle, and leave little room because we're going to pull that skin down and into that clavicle area, because this is where it's going to dump back in to your circulation system. So I like to do these alternately. To save time in the morning, you can do this way as well, but all we're going to do is push backwards and then bring it down and in a little bit. So one-handed, it looks like backwards, down, and forwards. It's just a little C shape, not a closed circle, because you don't want to pull the skin back up. It's always going to be towards the heart no matter where you go. So backwards and down, and you're breathing with this because you're clearing the whole pump at the same time. So a breath actually helps here too. So inhale back, around, down, exhale again, back, down. We'll call that 3 and switch. And so things to think about is gathering all the skin, no pressure, keeping it the same, lightness. When you're pulling your hand down and around, not letting the weight of your arm pull it, staying light. I like the breath I see, breathing in, out as you come around 3 times. With 3, you may have already gotten a little production. I don't know. I'd love to know if people have. But at 5 to 7, which is what you would really be doing, you do 5 to 7 here, 5 to 7 here, 5 to 7 the inguinals, and you probably would feel quite a bit of flush. So again, one arm gets up and over, you want to rest it. So this joint, because remember, joints is where stuff gets stuck. You don't want to be all cramped up doing this. You want it loose, super, yeah, things not to do. So just super loose, however you're comfortable. If your arm doesn't do this, find a way to lay down. Just, you can do it gently here. Just find a way to just use pillows. But however you can get this as loose as possible. If you have a problem with tightness, as we do through here, do a couple just shoulder openings, think wide, think space through the armpit, and you're just joining this ball of your armpit. And again, this one actually I pull in towards the heart and down, in towards the heart, down. And you're doing this kind of at the same rhythm everywhere in your body. I'm going to go ahead and do 5 because it feels good. And then other side, 1. And don't forget the inhale, exhale down, inhale, in, and exhale down. And now for the inguinals, I am going to tilt this a little bit. I'm just going to do this where I'm seated here. Are you going to be able to see this okay? Essentially, you want the leg out. You don't want it tucked because, again, you're pulling all of the fluid, not just in this area. So you want the leg as open and loose as you can, propped, good. A little height is good, again, because of gravity. Go, Liz, go. The height's good for gravity. And then you just rest your hand. I often do two because I like to do the full area as much as I can, but it has to move. If one hand's moving, this hand has to move with it. You can't be like push, 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 push. It's got to move together. Okay. So it's just with one hand, it just looks like inwards, and then you're pulling that skin up. Two hands, I usually do it about like this, and then rotate it inwards, and then just pull it up into that hip, right into that groin crease. You can play with doing it kind of up onto the top of your leg, like right here. But if you come over on the side, we're working a different part of the lymphatics. But since the joint space is where stuff gets trapped, you can work on these joints as much as you want, but it's kind of like 5 pumps in one area, and then move to another area, do 5 pumps in another area more towards the back of your hip if you're going to work around that hip joint. But so flush comes right up here into the inguinals. Make sure you do the other side to keep yourself even. And I don't know if you can see this well enough. And again, inwards.
Danielle
And
is
it's
asking.
whatever feels comfortable to you guys. It's kind of the position that you feel comfortable. It works all different for everybody. Nobody likes it the same way.
Danielle is asking if you can show the leg one more time.
Yes. And here, let me pull this closer.
You wouldn't want to be standing doing that, certainly not on your leg, correct?
Well, so if you think about gravity and everything needs to go towards the heart, yeah, you would rather have your legs up on a wall doing it than anything else in here. Let me.
I think you need pants that have fabric blocks that allow us to see, because the black is
I know. I know. Sorry, guys. Here we go. So here's the inguinals, right? And I'm just going to do this with my feet on the floor because that is okay. So this is my inguinal right here. And just 2 hands. This is right behind it. This one's right behind this. And I'm just going to rotate that skin inward and then pull it up into that groin. Again, inward and up into the groin. Inward and up. And this one typically does stay tighter than the others. We carry a lot of tension here, sitting, seated, driving, everything. So you're probably not going to feel anything in 3 passes here. 5 to 7 is very appropriate. In all the videos they've been teaching on the Lymphedema Education Network stuff that they've been sharing online this month with Lymphedema Awareness Month, they give very detailed instruction on a lot of this stuff. And they talk about compression wrapping. After you open up all these areas, once it's flowing and you get that full body massage, so after you open up these primary areas, then you would start working fingertips up towards the joints, right? And same thing, ankle up towards the joints with these small passes that we showed you at the beginning. But after you really get that all going, I kind of lost my train of thought there, but you just don't want it cramped. So then compression would then help all of that. If you're compressing the legs, if you put on bike shorts, any sort of compression is then going to help that fluid continue to move through those big joint spaces. So if you have pelvic floor congestion, if you have swelling that seems to be more internal than visibly external, bike shorts are a good thing. You do this massage where you open these up and then you pull on a pair of bike shorts that comes up to your abdomen. So you're getting that extra compression along your abdomen, and that's assisting that fluid move through more effectively. You take the shorts off to do the massage and open it back up. You put the shorts back on after. You do the compression after you do the massage again. So that's just another thing they do more in detail, but it goes hand in hand with lymphatic massage work. And it's always light touch. It's always with breath. It's always gentle, gentle. You're going to want to always open up the prime nodes before starting to work up the arm, up the leg. And then there's also a whole other facial protocol, which is wonderful. Thank you. There's a facial protocol too, and that really does focus on draining a lot of the neural lymphatics. And it essentially is, again, the skin stretching starting because we want it somewhere to go. So you clear out here first and then give this somewhere to go. And it's just a little spider stretch that slowly moves outside. So kind of 3 little passes and a spider stretch up towards the ear. And then you think about where do you want it to go. So then you do these drains of the neck again, a couple pumps, and then you come back up here and do just above the jawline, same little guys. And just little tiny circles, no pressure, Liz. I'm looking at yours going deep, and the goal is skin stretching, not pressure inwards. So if anything, you're doing that same. So all you're wanting to do is move that skin. And then you're pulling it up towards the ear because we know the drain is here. And then you can drain this little neck area with a little pump here. And then you come back and you're doing the sides of the lips. You follow the line above the lips, same thing, skin stretching. You follow the line beside your nose and the one under your eye. And same thing, just tiny little skin stretching, a couple passes at a time. So it's like 3, 3, 3, 3, 3, 3, 3, 3, 3, 3 here, 3 here. Tiny little ones under the eyes. And again, these drain just in front of the ear. So giving this ear some love is always going to help drain. Doing the entirety of your ear is one of the most relaxing things. And all you're doing, again, a lot of us want to pinch, we want to pull, we want to dig into this stuff. Opposite concept, deeper effect. Because this lymph system goes all the way to bone marrow, people. Like, this is a siphoning system that gets all the way down deep, all to the organs, all to everything. So that inclination to pinch and pull, yes, it relieves pain, but you think about why. You're causing inflammation and it's reacting to that, and you're not giving your body a chance to flush out the inflammation, really, which is what this is, trying to do. So if we dig in, we're going to create inflammation. It's going to pool in response to that, which is an opposite effect. So go lightly, lightly, lightly.
Kelly.
Yes.
That's awesome. And I'm
You got
very excited to do more on my face.
quick one. Yeah. And then always come back and clear the big nodes. And then, call me with any questions. I know it's a lot of information to throw at everybody, but I wanted you to get the full picture.
We have about 5 minutes left. So if anybody has any questions for Kelly, please pelt her with them because she's ready.
Help me with them. That was a lot. Sorry, guys.
I love it. Kathy, did you have a question?
So yeah, Kelly, do you do the lymphatic massage for people, or do you just train them to do it themselves, a protocol for themselves?
No, I do it for people. It is more productive if you have someone else doing it for you, for sure.
She's amazing.
And it is a full body. I love you, Debbie. Thank you, Debbie's come. Yeah. Yeah. It's productive, but I will say once you get the kind of first flush outs, it is easier to maintain at home. Through COVID, I've done some like hour-long coaching sessions daily to get people in the right routine, which has been really helpful for people. And I'm happy to shorten those or make them longer or whatever, and just kind of get people the information they need. And then the other thing we kind of add to that is actually getting on a rebounder trampoline. So that's kind of a fun, I don't have to do it in person, but a rebounder trampoline is really the best effective at home, easy, cheap way to keep that fluid moving without doing much at all. Because I mean, you can build up. I had to put that rebounder trampoline in a doorway beside my bed to build up to working on it where my body would physically respond well. And then I baby coach people through that too. And that doesn't have to be in person. That can be online or phone or whatever.
So for the people who've experienced a lymphatic massage, what would you say the difference is between that and a regular muscular massage? And can you combine them both? Like, do you do both, Kelly?
Well, I'll let them tell you what they think first, and then I'll tell you.
Okay, thank you.
So I've had both, and both like in the same month. And I think that with the lymphatic massage, you're just doing a different system. You're doing the lymph system versus the muscular system. And so what you experience with deep tissue massage is a release in the muscle, whereas this is more a release, I would say, in the fascia, in the lymph system. And it's you have to experience it.
But I mean, if you're looking for distinctions, the distinction would be, I would say, the pressure, right? Like And Kelly is so like, she's my drill sergeant with this. She's lighter, like this was her coaching me. She could tell it's gentle, it's light. It is absolutely the antithesis, I would say. Maybe not the antithesis, but it's pretty polar opposite to a deep tissue. You're not getting like my husband, because she's worked with both me and my husband. And my husband had no idea. He thought he was getting like a relaxation massage. I was like, no, you're getting flushed.
You're getting a flush. Yep. They
And he
call it
loved
flush
it.
massage sometimes too.
I think he did fall asleep on the table.
Most people do. It's crazy.
It's very relaxing. And then it's, for me, it's the after effect. Like a day or so after a massage, I might be sore or stiff. 2 days after my first lymphatic massage, what did I tell you, Kelly? Like, I think I just had like a weird emotional outburst with somebody, and I was like,
Clearing. It's a clearing.
Some stuff out.
It gets some stuff out, guys. It's what it does. People cry on the table often too. Is something that happens. I mean, there's a lot of release that comes with traps. So I mean, when I talk about holistic practitioner Kel, I'm like, it is it's a clearing that can happen. And daily attention on anything, I'm a firm believer on, like, there's that capability. So if you approach a situation and you approach this lymphatic massage as relaxed as possible, it's going to be more productive. Just like anything where we hold tension is going to trap fluid. If we can relax, everything can flow better. So and I'll say the main difference there too is the reaction. If you have a lot of chronic stuff going on, I mean, I talk about Lyme disease and stuff a lot. If you have chronic stuff going on, there is the potential to really release quite a bit. So if you do a regular massage and you're digging in and you're doing these things, it's just a total different modality. It's bringing fluid to an area in a different way that would more encapsulate it if you're working hard on an area. So this is more about clearing fluid through places. Yes.
Kelly, I think you're just going to have to come back and do another presentation. And you guys, most of you who know me know that I'm not obsessed with, but I love workshops. I love the idea of spending 2 hours with somebody who's going to take us through something. So if we want Kelly to do that, let's just ask her, right? Because she's awesome.
I'd always do it. I want everybody who's got chronic stuff going on to understand the inflammation clearing aspect of it. It's so simple to be like, treat inflammation, nothing can grow. Nothing can, you treat the inflammation and give stuff a chance.
Self-massage too is a big part of the Ayurvedic philosophy, and doing it. They do it with oil, actually, not necessarily essential oil, but with sesame oil, that they do on a daily basis, and the importance of moving that lymph system.
Yep, that's good that you said that, Deb. A lot of citrus oils, I meant to mention, citrus oils are good for helping clear stuff out of the immune system. And a lot of, drinking water every 15 minutes instead of like every hour gulping, to keep that constant flush through kind of situation where you're just continually hydrating and resetting will help once you are working on yourself at home to have that fluid push through as well. Just staying really, really well hydrated consistently throughout the day.
I'm so glad you came today.
Just to be sure, do you have a space, or are you doing at home, or how are you doing it?
So at Excel Body Fitness, just COVID safety wise, I moved out of my small room and I do it in a bigger room at Excel Body Fitness in Cary. And that's easy to book pretty much anytime. They're super flexible. They're very open with me. For women, we do it in an open space that's in a bigger, well-ventilated, the ladies' locker room. There's a sauna there if you want to use that as well. And they keep everything very clean. Do temperature checks and masks and stuff as well. We're doing things clothed, loose clothing. You don't want anything binding, no bras, tight bands, no tight elastic at the waist or anywhere. And, kind of a lightweight material, not super thick, like heavy sweaters, heavy sweatshirts, so I can feel, because a lot of it is feeling through the massage. But traditionally, this is not a massage that was ever done with oils naked clothed, or naked with oils. It was always done clothed because it was for people who couldn't move very much anyway. So you're not asking them to get undressed and all that, but it is lovely. And I do another version as well when COVID opens up and we're doing skin contact and oils again. It is kind of a blend of a traditional massage with, you would get undressed to your own comfort level. We would have a sheet that we moved around, and we would use a little tiny bit of oil, just enough to feel that skin stretch. But too much slippery oil defeats the purpose. You can't pull the skin that way. So it's usually not with oil for us, but citrus on the feet, different oils that clear the lymph system are really helpful. Aromatherapy is something I keep wanting to learn about. So Deb, thank you.
Kelly, thank you so much for coming and not just teaching us, but getting us involved in your presentation. I think it's wonderful. I'm so grateful that you came. Like I said, this is my birthday month, so I'm very happy that you're here with us.
Happy birthday. Let's celebrate. Thank you so much. This is cool. And I would talk or help anybody out. So just call, let me know any questions you have. Happy to do it.
Yeah, and we definitely have all of Kelly's info. I'm going to close this meeting now because it's after 1. But you know how to get in touch with us, and we can definitely get you in touch with Kelly if you haven't caught her info in the chat. Thank you guys so much for coming.
Kelly,
next
what's your
month we
number?
have our marketing development speaker.
Yes, Sage Harper. Awesome. So we'll
Thank
see
you.
you guys next month.
Kelly,
Thank
what's your
you,
number?
everybody.
Thank you, Kelly. That was awesome.
I think I hear somebody asking what's what, my number.
Yes.
I'm so sorry. I have not typed it in here, but I will give it to you. Do you have a pen?
Yep.
It is 336-601-1416. 1416.
Okay, thank you.
And I would
All right.
love to connect with every single one of you. It's awesome. Thanks, guys.
Kelly, you're a rock star. Thank you so much.
Mwah. Bye.